Hi everyone, welcome back. So today's topic is Brazilian Jiu Jitsu, and I am going to be talking about the type of injuries that you are likely to be at risk of if you do this sport, and ways that you can prevent these injuries from happening. Brazilian Jiu Jitsu has certainly become increasingly common in the last few years, probably because it's got so many benefits, increased strength, weight loss, muscle gain, and increased cardiovascular endurance, as well as, people obviously find it a good sort of social thing to do. But, whether you're new to this sport or, you've been doing it for a number of years, the injury risk is still high. And, this is because of the amount of groundwork. You've got head, arm and leg locks, choke holds. And although the injury risk isn't as high as with other martial arts, such as judo, because things like that involve a lot of throws. So that's why, the jiu-jitsu injury risk is a little bit lower, but there's still a high risk. Obviously, a positive attitude to training can certainly help reduce the risk of injury, but the risk, it's inevitable that at some point you are going to experience some kind of injury. And in fact, research has actually reported that 59.2% of people doing Brazilian Jiu Jitsu suffer at least one injury every 6 months. So that's more than half of, everyone doing this sport. And 9.2 per 1,000 exposures on tournament days have resulted in injury, which may not sound very high, but then 7.2 out of these 9.2 are orthopedic injuries, which do tend to be a bit more serious and involve longer recovery times. The most common type of injuries usually involve the knees, hands, fingers, feet, toes, elbows, shoulders. More experienced athletes suffer probably more actually with lower back injury, but the less experienced athletes certainly are more affected by the head and upper extremity and elbow injuries. And maybe that's because, they haven't quite got as much experience in avoiding, things like arm bars and things like that really, strain those areas. Upper extremity injuries occur more often than lower extremity, but tend to be less severe. And it's those, leg injuries that sort of tend to require a lot more time out, to recover. There's a 6-month injury incidence is more, linked to sort of the number of training days a week and instructor status rather than years of training and body weight. So, experience and, how big you are doesn't necessarily make any difference in terms of avoiding injury. And also, it seems that those that spent less than 50% of the time training with a gi were at higher risk of ankle injury. So it's a little bit unclear as to why that is, but yeah. So anyway, we're going to look at the most common types of injuries in Brazilian Jiu Jitsu, and for each one we're going to sort of explain how you can reduce the risk of these happening. Okay, so the first injury, which is really a minor injury in comparison, is mat burn, which is where basically excessive friction with the mat causes the outer layers of skin, to be removed. It is a minor injury, but certainly it can still be really quite painful for a few days. And the fact that this often happens on the feet, means that sort of when you're walking and everything, everything's going to rub on that area, making it more sore. Now, the next one, which is probably also considered a bit more of a minor injury, which actually is also common in sports such as rugby, where there's sort of high contact, is cauliflower ear. Now, this is due to grappling. It's an impact-related trauma to the cartilage of the ear around the outside here. It's basically the trauma, causes separation of the cartilage from the skin, usually forming a hematoma. And if there are repeated hematomas, this can cause internal bleeding, and also external inflammation and hardening. And if untreated, the fluid between the cartilage and the skin will calcify, and it creates scar tissue. And then you get this sort of really bumpy, kind of deformed look to the ear. There's also an increased infection risk with cauliflower ears as well. Now, in terms of treatment for cauliflower ear, it's really a case of ice, anti-inflammatories. It's possible to drain the fluid in the ear with a syringe, and that will probably sort of also reduce, the chance of any infection. And also compressing the skin and the cartilage together so that they've got a better chance of healing. But apart from that, there's not an awful lot, that you can really do. You can try and prevent it by wearing protective headgear. Aim to prevent, your opponent from applying too much head pressure. And also aim to avoid too much head pressure on the mat. You can apply ice to ear pain after rolling, and just try to avoid rolling for a few days, which may be easier said than done. Okay, so the next type of injury that we're going to look at is neck injuries. Now, the neck is one of the most delicate areas of the body, and being stacked on your neck with your head being pushed and pulled can cause various injuries. Most commonly, a cervical sprain or strain, so that's around these top vertebrae here. Now, the cervical spine is the most mobile part on the back, so it's really quite easy to overlook injury, when you're in a hold. But neck injuries can take a few months to heal, so it's really important to be aware of, any changes or pain, around your neck. Another one of the sort of probably most common neck injuries in jiu-jitsu is a herniated disc. You've got 7 cervical vertebrae which support the head, and the cartilage discs that sit between these vertebrae act as shock absorbers, preventing the vertebrae from rubbing, against each other. Now, age, poor weight bearing can cause these discs to fall, sort of over the inner, it's like a gel-like material. And this can cause inflammation around the spinal nerve, tingling or numbness along the arms, and also radiating pain. And this is really, where you end up with compression of a nerve. That's why you get the tingling. The next injury for the neck is one we've kind of all heard of, which is whiplash, where a sudden force which pushes the neck forward or backward in a sort of sudden unnatural position can cause tears or strains. So how can you prevent neck injuries when you're doing your jiu-jitsu? Certainly, if you have an injured neck, make your partner aware of that and avoid positions where you can't control your opponent grabbing your head. Don't use your head as a base point. Now, it's not always possible to roll gently, so if there are persistent neck issues, then to be honest, you should probably avoid Brazilian Jiu Jitsu altogether. Certainly, common sense stuff. Always warm up before training. Don't, if you've got pain, don't just sort of plow on through at the expense of your ego. Okay, listen to your body, and if you've got pain, you need to stop. And then really just, you can do some exercises to strengthen the surrounding muscles of the neck, which will sort of just improve sort of shock absorption ability. The next kind of injury, we're talking about rib injuries. So here we're talking about things like bruised ribs, broken ribs, maybe damage to the sternum, which is the breastbone, damage at the sort of intersection between the bone and the cartilage, bruising. You may get pain when, taking a deep breath, or coughing, sneezing, laughing, heavy lifting. And sometimes, you can even kind of almost get like a creaking sound at the site of injury when you either touch it or move. There may even be an obvious deformity at the site of injury and difficulty breathing. Now, with rib injuries, it's difficult because there's not a huge amount you can do, but you're looking at kind of a 4 to 6 week time period for recovery, with no Brazilian Jiu Jitsu, and that's kind of non-negotiable. If you return before this time, even if your pain has subsided, then the likelihood is it's just going to result in a much worse injury. And this is because of, just the tackling nature of Brazilian Jiu Jitsu. So yeah, any rib injuries, just take that time out. Back injuries. Back pain is certainly very common when the lower back becomes compressed due to usually an opponent's full weight bearing down on the guard player when stacked. Poor technique during, a poorly timed takedown. So, for example, by that I mean sort of lifting with the back instead of with the hips. That will certainly result probably in some back problems. It may be strained muscle due to pulling or lifting in an uncomfortable position, maybe which causes spinal flexion in the wrong direction. Pain will usually start a couple of hours after injury, and you can treat that with ice and gentle stretching. Another common back injury, which we sort of covered with the neck, is herniated disc, which is an immediate injury which will cause pain down the lower back and usually down to the leg. And this, you need immediate medical attention if this happens. So again, don't just kind of continue. In terms of preventing back injuries, the most sort of common sense thing is learn correct, technique. Learn how to roll properly. Doing a lot of stretching, yoga type exercises to increase your flexibility and stability of the back and those core muscles. Will really help when you're being pulled into more unnatural positions. In terms of a strained muscle, just, avoid positions that compromise the spine, close guards, mounts and bridging. Okay, so going on to shoulder injuries. Now, the shoulder consists of 4 joints. So you've got the glenohumeral joint, which is that ball and socket, between the head of the humerus in the upper arm and the glenoid cavity of the shoulder blade. You've got the acromioclavicular joint, which is where the clavicle meets the acromion of the scapula, which is that top border. Then you've got the sternoclavicular joint, which is where the clavicle or collarbone meets the chest bone, sternum, so it's here. And then you've got the scapulothoracic joint, and this is where the scapula meets with the ribs at the back of the chest. Now, there's actually quite a lot of dense musculature that allows for free movement, in that joint. And, that can be a good thing. But it also means there's a lot more tissues, that can be injured, in the one area. So shoulder injuries in Brazilian Jiu Jitsu tend to occur, as always, from overuse, but also any explosive movements, so stubborn arm attacks, twists from rolling, or prolonged active posting, and also from shoulder lock submissions, which can result in rotator cuff injuries if held for too long. So again, it's being sensible and it's knowing when to tap out and things like that. Now, okay, so if we look at treatment of shoulder injuries, it's standard. Muscle strain, you're going to use ice and rest. If you end up with a severe dislocation, this is one of those things where you need immediate medical attention, and also need to be checked out before returning to jiu-jitsu. Rotator cuff injuries, again, ice and rest, and then you're probably going to want to do some strengthening exercises once the pain and inflammation have subsided. So if we think about traumatic shoulder injury, so by this I'm talking about getting taken down and landing on your outstretched shoulder, which can injure the rotator cuff muscles or even other parts of your shoulder. So how can we look at preventing injuries like this? Well, the best way is tapping early and regularly, and just learning how to break your falls properly. So it's not sort of anything overly complicated. It's just common sense and knowing your limits. In terms of a traumatic shoulder injury, so this is where maybe due to overuse or even underuse, it will be a gradual onset, where you just sort of keep thinking the shoulder doesn't quite feel right, and then maybe pain will develop, on movement, and it will get worse until it's, unbearable. With these type of injuries, if you have a mild shoulder injury, you may find that tying one hand up with your belt and rolling, while it's difficult, it may help. But strengthen your shoulder. The rotator cuff, helps move the shoulder in various directions. So just do some exercises to really strengthen those muscles and stabilize that shoulder a bit better. In Brazilian Jiu Jitsu, some of the rotator cuff muscles are prone to overuse, while others are underused. And, it's this muscle imbalance that can actually cause injuries as well. So, doing the exercises, or, going for regular sports massages, to strengthen those ones that are underused, and just kind of relax and maintain the flexibility in the ones that are overused, will really help to reduce your risk of injury to this group of muscles. But also you want to think about strengthening the surrounding muscles, which also help stabilize the shoulder. So we're looking like upper back, upper arm, and into the sort of pectoral area. And also, even the lats as well, on the side there. As I say, that will just help, again, stabilize the shoulder further. So, okay, so the next area is wrist injuries. So we're looking at things like a sprained wrist. Usually occurs due to sudden bending of the wrist in order to stabilize yourself when breaking a fall, usually with an outstretched arm, and then all the impact goes through the wrist. It also happens with wrist locks and attacks. Then you've got elbow injuries, which, the elbow is actually a very fragile joint. It's unable to tolerate hard impacts and is therefore very prone to injury. And if there is a repetitive injury, this will more than likely become permanent and result in chronic pain. So, you really need to be aware of any sort of changes in your elbow joint. And the probably the thing that carries the really high risk of elbow injury is an arm bar submission, which is basically hyperextending that arm, and that carries a high risk of elbow injury, which can be anything from broken bones, torn ligaments, torn tendons, if you don't submit quickly. So again, it's about knowing, when to tap out. Posting on the mat is the next most common cause of injury. The impact of our body can cause hyperextension of that elbow, which again, can cause ligament and tendon damage. So in terms of strains and sprains, so strain, we're talking about torn muscle or tendon. Sprain, we're talking about torn ligament. These are usually caused by bones or tendons moving past their unnatural position, past their natural position and range of motion. And it will cause, obviously, pain, swelling, and inability to move the arm or the elbow. With a sprain, you will usually hear a kind of a pop at the time of injury, and there will be, bruising will be quite quick to appear, possibly with swelling as well. And so the best way to treat that is really, again, rest, ice, compression and elevation. But if it is serious, to where you're kind of really losing function of the arm, certainly seek medical attention again. Another common elbow injury is tendinitis, which is where you get inflammation of the tendon, which is caused by repetitive movements and overuse. And again, it's a case of using warm packs, ice packs, anti-inflammatories. You've got two types of tendinitis with the elbow. So you've got lateral epicondylitis, which is on the outer edge. So that's otherwise known as tennis elbow. And you've got medial on the inner side, medial epicondylitis, which is known as golfer's elbow. And do keep your eye out, because I will be doing a video on those, those two injuries. Another elbow injury is bursitis, which is basically inflammation of those fluid sacs or bursae, which cushion the joint, reducing friction between the bones and the tendons and muscles. And this is usually caused by a repeated impact on the same area. It will cause swelling around the joint. And you need to treat this with ice packs again, and just avoid training until it's healed, because if you don't, it's going to get a lot worse. Probably one of the more severe and most common elbow injuries in Jiu-Jitsu is actually dislocation of the elbow, and this will result from resistance to a submission move when taken down hard or pushed into the mat. It's caused by the bone being pulled or pushed out of place, and it can be a partial dislocation or complete. It can be simple or complex. There's quite a wide sort of range, in terms of dislocation. But certainly you need to seek immediate medical attention, because you don't want to get, with dislocations, you can also then end up with nerve damage and things like that if it's not, treated immediately, and if it's not treated properly. And again, you've got to avoid fighting until it's completely healed. And so again, I would be saying seek medical advice before returning. Now, the other injury with elbows is fractures. Obviously, this can actually put an end to competing. It can take a long time to heal, and sometimes, it doesn't even fully recover. It will be caused by a hard fall, which impacts on the elbow, either through a twisting motion or a hard push or pull. And it will cause severe pain and bruising. And, in terms of treatment, it needs to be plastered as soon as possible. Now, I mentioned also there in passing about compressed nerves when I was talking about dislocation. So this is usually with the ulnar nerve, which kind of runs up from on the side of the little finger, up the forearm. So we're talking ulnar nerve entrapment, which is caused by repeated impacts on the elbow, and then you're going to get swelling due to injury, which will then compress on the nerves. It will cause numbness and tingling in the fingers, and it's also going to weaken your grip when fighting. In terms of treatment, bracing, splinting, you can do nerve gliding exercises, anti-inflammatories obviously for pain, And again, sports massage to just, release any tight muscles or tendons that again are pressing on the nerve. Then you have a UCL injury, which is the ulnar collateral ligament. It's damage to this ligament. This takes a long time to heal, and again, it may not, recover fully. So it may be one of those things where, you have to consider continuing with Jiu-Jitsu. But in terms of healing and prevention, healing the elbow is a little bit different to other joints. Now you've got 3 stages. So first stage is inflammation. Second stage, the elbow needs to get, in motion and be able to move. And then the third stage, you have to do those strengthening exercises for the elbow. So we'd be looking at things like, working on the muscles of the forearm, and also gripping exercises. And it really is important that you get that physio input or sports therapy input with that. Okay, so now I'm going to go on to talk about knee injuries, which there are quite a few, and you may have seen some of my previous videos on specific knee injuries. Certain moves certainly will put the knee at increased risk of injury. Now there's something called a heel hook, which actually is banned by a lot of places, because it can cause the opponent's leg to be to be broken in multiple places, as well as torn ligaments around the knee. But also things like the knee bar, where the opponent's knee can actually snap due to hyperextension, rather like with the elbow. The rubber guard also puts strain on the knees of the person who does it, placing their shin over the opponent's back while in their guard, thus overstretching the knee. Doing the full lotus position will ensure enough hip and knee flexibility to reduce the risk of injury. Performing leg locks incorrectly can push the knee joint in the wrong direction and most likely cause torn ligaments. So if you're feeling discomfort when rolling, you need to tap out to avoid further damage, that could take you out of the sport for quite some time. If you've had a knee injury, again, returning before it's properly healed is never a good idea. To ease yourself back in, it's better to just concentrate on hands defense with the knees tied together with your belt. But too many people make the mistake, and knees are a difficult joint anyway. They think, oh well, I'm not really in pain anymore, but actually knee can take quite some time to heal, especially with these ligament ruptures and things like that. So it is important to just be on the cautious side. Broken bones, dislocations, obviously due to heavy impact, due to holding on to submissions during competitions without tapping out. So again, listen to your body rather than holding on to your pride. In terms of preventing these sort of injuries, tap quickly, tap often, in submissions. And again, just, learn good technique, learn how to fall properly, and that will help to reduce the risk. We mentioned there about hyperextension of the knee. Now, when a synovial or hinge joint, such as the elbow or the knee, is extended in a straight position beyond the normal range of motion. Usually this happens in submissions such as an arm bar or a knee bar. Injuries are going to be common. So again, it's knowing when to tap out. But to prevent these injuries, you've really got to stop the joint from being hyperextended. So you need to tap before the hyperextension is reached or as soon as pain is felt. Now, torn ligaments are a common knee injury, which usually result from incorrect technique or from rotational submissions, particularly that heel hook that we mentioned, which places the knee under a significant amount of stress due to rotation of the ankle. So in terms of preventing, again, tap early and often, but also strengthening exercises, things like squats, deadlifts, to strengthen those tendons and ligaments around the knee, and to strengthen the muscles, that's, such as the quads that support the knee as well. So if we look at the ligaments, the two main ligaments that we're thinking about are the ACL, which is the anterior cruciate ligament, and the MCL, which is the medial collateral ligament. So the ACL basically prevents hyperextension of the knee, and is injured when, as we've said, overdoing a move like the knee bar. ACL tears, I can vouch for this, really will destabilize the knee, and usually will require surgery. And you have to be really careful because, again, it's a long recovery process, and it takes a long time for that knee to heal properly on the inside, even when the outside seems to be fine. There can still, once you've had that type of injury, if it's a complete rupture, that knee may never, be the same again. So you really do have to be careful. Okay, so the MCL, which is at the side of the knee, basically holds the sort of lower leg and the thigh together. It's often injured, with sort of twisting movements of the knee. It will cause pain, swelling, and instability of the knee, much like with an ACL rupture. But MCL injuries usually heal on their own without surgery, but it does take time and you must rest. So again, it's no jiu-jitsu for a while if you want this to heal. The other common type of knee injury, which I've again done a previous video on, is meniscus injuries. Now, the meniscus cartilage discs are basically shock absorbers for the knee. They help absorb the impact. And they're usually injured through either sort of incorrect technique or sudden explosive movements. A torn meniscus certainly will cause pain, swelling, and a feeling of weakness, and as if the knee is kind of constantly wants to give way. You'll also find that sporadic knee lockups are also common with meniscus injuries. Now, these happen really due to not knowing how to defend, or not submitting in a leg lock. It can happen with explosive grappling or scissor takedowns. Any sudden knee hyperextension again, when, you know, suddenly changing direction and stopping. But yeah, I mean, these, you know, these injuries and the ligament injuries, you know, a lot of them do need surgery and they do need a lot of time out. So that's probably the most important thing, is time out and rest. In terms of reducing the risk of knee injuries, you know, as we said, strength training, you know, to really strengthen the sort of knee, the muscles that support the knee, and to strengthen those tendons. So things like running, squats, weighted squats, deadlifts, lunges, those are the sort of exercises you want to be looking at. And also you want to think about improving your hip flexibility, you know, because the hips will move in different directions, whereas the knee can only bend and extend. So if the hips are stiff, then your knees are going to overcompensate and take more of the impact, which again is going to increase the risk of injury. So yeah, sometimes it's just about working on those surrounding muscles and joints as well. And again, this is where sports massage can really be helpful. Now, in terms of returning to Brazilian Jiu Jitsu once you've had an injury, you know, people are often in so much of a rush to return to a sport before their injury is properly healed. You know, and I get it, you know, it's it's great for your mental health and obviously physical health. You know, it's quite often a social thing for a lot of people. And I think for those of you that compete, you know, there's very much that sort of type A personality where you tend to kind of just, you know, push on through, and, you know, you constantly want to prove to yourself and prove to others that you can do even better than the time before. But actually, you know, rushing back too soon after injury simply increases the risk of a repeat injury, or, you know, injury in another area, because you're going to be overcompensating. So by following 3 simple steps, you know, you can reduce the risk of a repeat injury. So first thing, be sensible when it comes to training. You know, make sure that when you're coming back after injury, you are, you know, building up gradually. You know, ensure you've got the right intensity. Intensity should be increased slowly. If there's been a longer recovery period, you know, it may be worth just returning to a sort of beginner's level to begin with. Using the right positions, you know, the way that you compete may change if you've had an injury. And, you know, for example, if you've had a neck injury, you know, the risk of re-injury would be reduced by replacing an upside down guard with a more closed guard. So it may just be a case of modifying, you know, preferred, you know, techniques. We've said it a lot in the course of this video, tap quickly and often. You can't control your opponent's play, so if you're in a compromised position that increases the chance of re-injury, choosing to tap out is the best option. You know, and when you start back, you know, try and work with the right partners if possible. You know, choose to partner up with someone that you trust, who, you know, lets you move at a good pace with control, you know, and who isn't directly going to think, oh, he's injured in that area, I'm going to hit that. You know, initially, you know, pain may have subsided, you may feel fully recovered, you know, but, you know, internal healing takes a lot longer, and until the injured area, is faced with the challenges of something like Brazilian Jiu Jitsu, you may actually be unaware that there is, still quite a bit of weakness there. So, going in gradually is really important. Okay, step 2, in returning to training after injury. A little bit of self-assessment can go a long way. And it's important to be honest with yourself and to reflect on how you're training, and how your training methods may have contributed to your injury. Think about any changes, that could be made. So, ask yourself things like, have you been overtraining? Are you warming up properly? Have you been stressed, on the day that the injury took place? Did you get a good night's sleep the day before you had the injury? Could you have tapped out maybe a bit earlier? And by just evaluating, yourself, it may be that you can start to sort of recognize certain patterns, and find an alternative way, in the future. And then finally, step 3 is, look at your training program. Training shouldn't only include, strength and flexibility training. It's also about corrective exercises following an injury. And any muscle imbalances or overuse needs to be addressed regularly. Now, you can do this through exercises, but the best way is through sports massage, because it can strengthen any weak muscles while relaxing, any tight areas. So it can really work on both ends of that muscle imbalance. And just remember that, you love this sport. Everyone that I know who does Brazilian Jiu Jitsu, it's very much, it's almost like a way of life. It's, it's not just a once a week thing. It's a thing that people, they tend to kind of do a few times a week. And, your aim is, when you are so involved in an activity, is to train for the long term. And especially if you're competing as well. It's not about just training for the immediate post-injury period while you're recovering. If you look after your body, then, when you're out there competing, hopefully your body should look after you a bit better. And, hopefully your risk of injury will be reduced. So that's really all the information. I hope it's been of some use, but feel free to look at my other videos. As I said, I do have other videos on specific injuries and specific muscle groups, not jiu-jitsu related, but just general posts, things like meniscal tears. So do take a look at those. I will have more coming up, so you can subscribe to my channel. You'll be notified when they come out. Feel free to comment down below, or you can message me with any questions through my Instagram or Facebook pages, and I will come back to you with an answer. But for now, that is really it from me. Try to stay safe when you're out there, in all sorts of weird positions. And I will see you next time.